In my own experience, loneliness was probably the most prevalent experience I observed among older people, and that longing for connection or that absence of companionship weighed heavily on people's daily lives.
Welcome to the HSE Talking Health and Wellbeing podcast. My name is Eamon Keogh. On this episode, we'll be discussing the safeguarding and prevention of elder abuse. Sadly, more prevalent than you might think and sometimes hard to identify, but it is a very real problem. We all hope that we can grow old gracefully and with the support around us. Sadly, this is not the reality for too many of our elderly population. World Elder Abuse Awareness Day, which takes place each year in June, aims to shine a light on this topic. Joining me to tell us all about this are Tim Hanley, General Manager, and Teresa Cronin, Director of Nursing, both of whom are working with the HSE National Safeguarding Office. You're both very welcome to the podcast.
Thanks, Eamon, and delighted to be here today.
Thank you. So, Tim, we might get straight into this. Can you explain what elder abuse is?
Yes, Eamon, we take and work from the World Health Organization definition, and the World Health Organization sees elder abuse as a single or repeated act or a lack of appropriate action occurring within any relationship where there's an expectation of trust and which cause harm or distress to an older person. And what that definition means is that where somebody is, it could be in a caring role or family member, community member, where there's an expectation that they provide care, they assist the person, or have a duty and a responsibility, and they abuse that trust. And it could be physical abuse, sexual abuse, psychological abuse, financial abuse, and it has an impact on the older person. It can be intentional, or it can be an act of omission or neglect.
Okay. And does it affect many of our elderly population?
Well, if we look at kind of international studies and kind of prevalence studies, we know what the WHO tell us, that each year 1 in 6 persons aged over 60 will experience harm or neglect in their lives, which is a very significant figure. And there's been numerous kind of international studies done around this. So it's a significant public health issue. It's a significant societal issue. And it's also a significant issue for us in the health and social care sector, along working with our partners.
Yeah, okay. And you mentioned the different types of abuse there, but could you talk us through a little bit more about those?
Yeah, so older people can experience a variety of abusive contexts. And I always start this by saying the clear majority of people who actually act with good intention and could and want to do the best and have well-intentioned. However, situations can arise where, as I said, by act of omission or neglect, an abusive situation can arise. And that can take any type of a context. It can be somebody bullying an older person around property. It can be somebody stealing someone's pension or reports of their pension, handover of property. It can be controlling behaviour, psychological abuse, preventing the older person enjoying daily living activities, and right up to serious sexual harm and rape, which can happen. It's one of the lower rates of reports into us, but it has a very serious. One thing I would say, that types of abuse can often happen together. So if someone is being abused, someone's their money taken off them, they're being neglected, it can also be psychological abuse. So it can happen together and at the same time.
Okay. And Teresa, we were talking earlier and you had some pretty stark stats there around this.
Yes, I suppose as Tim said, 1 in 6 people over the age of 60 experience some form of abuse each year in the community settings.
Yeah.
But also that 2 in 3 staff, or 64%, have reported committing abuse against older adults in institutional settings.
That's very high, isn't it?
It's pretty stark. And we know that the impact of abuse can lead to serious physical injuries as well as long-term psychological consequences. In Ireland, as in elsewhere, there's significant underreporting. That's one of the biggest issues, I think. In 2023, while we had 18,000 safeguarding referrals into the 9 community safeguarding teams, there was 5,500 approximately over the age of 65. That was a 13% increase on the year prior. And we also had a 32% rise in reports concerning the over 80 age category. So we know that abuse of older people is predicted to increase due to the rapidly ageing population. And we know that the global population over 60 in 2050 is going to be 2 billion. And Ireland is projected to have a population of over 65-year-olds in 2050 of 1.6 million.
So as you said, it is a significant public health issue that needs to be dealt with. And can you tell me who can abuse an older person?
So even that can happen anywhere, by anyone. And what I mean by that is that it can happen in a family home, it can happen by a neighbour or a friend, it can happen in a place of care, from a hospital, a nursing home or residential care. So when we talk about things like physical abuse and neglect and psychological abuse, it can happen in any context where there's a position of trust and care happening. There's sometimes this kind of view that it happens over there or it happens there.
Yeah.
And it can happen incrementally or gradually. People didn't start out in an abusive relationship, but something happened over time. Maybe somebody might have been handling someone's money or organising someone's care. And then over time, for a whole variety of reasons, the relationship became abusive.
Right. So it's not overnight, really.
We can have what we call stranger abuse, where someone comes to the door and scams someone around.
Yeah.
And that does happen.
Yeah.
And increasingly, we see more and more online abuse. But the research, and Teresa alluded to some of this in terms of international research, would show that the majority of people know the person who is being abusive towards them. So for sure, stranger abuse does happen and is something we need to address. In the majority of cases, and in terms of the referrals that come into us, it is somebody known to the person, which would be similar in the child abuse context.
Yeah. Teresa, going back to what you said there about the stat you gave around carers as well, that's quite high.
It is 2 in 3, according to the World Health Organization, that's staff. So that is across the settings, I suppose, across institutional settings. So anybody from carers right up to consultants, it's anybody that engages with older people.
Yeah.
So that covers that. But as Tim was saying, any of us can be vulnerable. I could go out there, be hit by a bus, sustain a brain injury and become dependent on care and support, or may not be able to manage my finances. So therefore, I will be more vulnerable because I have higher care and support needs.
Yeah. And I guess as we get older and families sometimes move away, or for whatever reason, some elderly people are impacted by isolation and loneliness. That's a big factor as well, isn't it?
Yes, I mean, I suppose it's something that we've seen in reports to us and working with the agencies that support older people and what they tell us. We know that as people age, and if they are poor and living alone and without a circle of support, they're more at risk of being harmed. And if people don't have access to supports and are connected into supports, then the likelihood increases. And that is why for this year in 2025, for World Elder Abuse Awareness Day, we looked at the whole theme of loneliness and social isolation, the impact it has, how one can maybe take preventative measures, and to look at what the connection is. Teresa can say a little bit more about that from a public health nurse, and we should have seen the impact of loneliness and social isolation across a whole range of health determinants.
Right.
Obviously, we're particularly focused here on people at risk of being harmed or neglected.
Yeah. And is it more prevalent in rural or urban areas, or does that matter?
Not particularly. I think it's across the board.
Yeah.
I mean, I worked as a public health nurse for 15 years, and in my own experience, loneliness was probably the most prevalent experience I observed among older people. And I worked in Dublin North and Dublin South, mainly urban areas, and that longing for connection, or that absence of companionship, weighed heavily on people's daily lives. Anecdotally, we have lots of research as well from the longitudinal study on ageing, the impact that chronic loneliness has on people's health and well-being, and therefore they will be more in need of care and support, and therefore more at risk of being abused, neglected or exploited because of that.
And when you say about being open to abuse and that longing for contact, isn't it, that makes somebody more vulnerable, or just open to that, just wanting to talk to somebody, really?
Absolutely, yeah. I think people would probably make poor decisions if they're suffering from chronic loneliness, and will take more risks. And we know they're more at risk of phone scams, visitor scams, cuckooing. There's quite a bit of research on that people will, because of that need to connect, I suppose, to other human beings, they will make those decisions. They prefer to have the company, perhaps, rather than lose a relationship, maybe with a son that may be taking some of the pension from a mother,
Yeah.
Yeah, and it was a really good point, Eamon, that need for human contact to have a relationship with other people. And if someone doesn't have a wide circle of family and community support, it impacts on them, as Teresa was saying, things like decision making, their ability to see what's happening to them could be an abusive or coercive abusive experience. I suppose the other area is that we're always very mindful. If someone has social connections and a good circle of support, family or community, there's more eyes, there's more people observing things. So it's not just the person themselves self-guarding themselves. There's also others, neighbours, family members, having a view of, actually, I'm quite worried about my neighbour, or I'm quite worried about my aunt. I've been in and I've seen this and I'm concerned about this. So, that is something that is a preventative protective measure. Hopefully we'll see things earlier before. I talked about that, how things mightn't start out as an abusive context, but over time, for a whole variety of reasons, the older person become frailer or more dependent and less stronger to assert what their views are. And maybe sometimes people who are looking after them might be in financial difficulties or addiction issues that put them in positions of making abusive interactions.
Yeah.
As Tim was saying, I suppose one of the aims of World Elder Abuse Awareness Day is to highlight factors that contribute to abuse. And therefore, this year in 2025, we're looking at loneliness and social isolation. And just a few stats on that. We know that 18% of people over the age of 70 report feeling isolated, according to Age Action Ireland. And then there's some very stark research from the UK. 198,000 people over the age of 65 in London had not met up with a friend in over 1 month. Again, that's 18% of the population of over 65s in London.
Yeah.
And even worse, which I thought was even more heartbreaking, is that 19,000 people over the age of 65 had not had a conversation with a family member or a friend in over 1 month. So that's pretty stark, isn't it?
Yeah. And I'm sure it's similar patterns in Ireland as well.
Yeah.
Society changes as both our rural and urban communities change, as the patterns of social interaction change. I know I'm a social worker background, but I also live in a rural area, and I've seen changes of people visiting. As a child growing up in a rural area, would regularly visit the neighbours, cousins, and it was part of community activity. So some wonderful work done by our older person support organisations, the phone line support, the home visitation services, the likes of Alone does. Aging Opportunities have been supporting a number of activities, building networks of support where maybe there was good social capital in communities.
Yeah.
So we have to kind of look at that, where we can build all that. Also be mindful that no one shoe fits all. Some older people don't particularly want to engage with defined services, be daycare, wherever. So we have to consider the will and preference of the older person, where they see support. I know when I started out as a social worker, we used to have one kind of view about when we did standardised assessments. If you have so much, well, therefore they should be receiving standard types of care. But now with that person-centred, we have to try and be more mindful that some people might like to live a bit of life, more solitude. Others see connections differently. Just that kind of view. Become hopefully stronger on our person-centred standards of assessments.
Yeah. And it's not, like when you were talking there, it even just checking in.
Yeah, it can be quite informal. It doesn't have to be a formalised arrangement. I think there's a huge amount of informal care goes on in our communities, urban and rural.
Yeah.
I think whilst the formal care, and be it home care, daycare, resident, is significant and is needed, but the informal care network is actually multiples. We probably don't even know the extent of it.
Yeah.
I think COVID put a spotlight as well very much on this, I think. And even the most recent Samaritans Impact Report 2024, they said that 34.7% of callers contacted specifically because of being lonely or isolated. And that was across demographics.
I mean, it strikes me, when there's a weather warning or something like that, or during the time, I know we haven't had snow in a while, but they always say check on a neighbour or make sure that anyone elderly in the community. Feels like that should be nearly a weekly announcement, really.
Yeah, I think it's about reinforcing that message. And as I said, both our networks and our community Gardaí are excellent, our formalised home care services. But it's also a message we would be saying that informal, doing the right thing as a good neighbour, as a family member, whilst there's need for greater, I suppose, we'll see this, we're going to statutory home care and the kind of reform of our health and social care and people ageing well in their own place. is a huge priority. But there's also a message here, a call to action here. We can all do a little bit, whether we're more in our analysis of how I do my assessments, coming back to my time as a social worker on the ground, that more kind of person-centred understanding of the person. But even if there are people here today listening who are members of the community, that what can I do? It doesn't have to be formal, it can be informal as well.
And I suppose as well, Tim, just for all of us getting older, to try to stay connected. It's so important. Keep that connection with your family, with friends, with organisations. Some people get quite lonely when they retire from work or whatever.
And there are some really good initiatives like the likes of Active Retirement Ireland and others, Mointon na Tíre. There are organisations out there. It's finding the match to the person, but we know that there are opportunities, and finding a way to stay connected is really important. So we should all be thinking about that as we approach our older years, how I stay connected.
Yeah. And actually, you mentioned it now, or we talked about World Elder Abuse Awareness Day, but I just wanted to ask you a little bit more about that day and what happens, I suppose, on that day.
Yep, World Elder Abuse Awareness Day was first initiated by the International Network for the Prevention of Elder Abuse back in 2006. And first observed as an official United Nations Day by the General Assembly in 2011. So again, I suppose the three aims is to raise awareness of elder abuse, to highlight factors that contribute to abuse, and we're focusing in on loneliness this year, and to encourage then communities to take action. Our tagline this year is "Connection is Protection." So it's a global call, I suppose, to protect the rights and dignity of older people, ensuring they live free from harm and mistreatment. And we know, as Tim said earlier, a connected older person is more visible, they're seen, they're heard, they're checked in on, and this can make it harder for abuse to occur and easier to detect when it does happen.
So you're really trying to break that isolation.
Absolutely. And how important relationships are. They're the powerful line of defence against elder abuse. So also not alone individuals, families, communities and professionals, but also government policy as well, across the sectors, in terms of housing, intergenerational housing, education.
One thing, Eamon, that's also very important for World Elder Abuse Awareness Day is the empowerment of older people themselves. So Safeguarding Ireland would have done Red Sea polling and looked at kind of people's understanding and their perspectives of what's happened to them. And we know that sometimes some older people actually don't see the behaviours that they've encountered as abusive. Whilst we've seen great work done around older people being much more empowered and their human rights front and centre, as they should be, with human rights seen now as core with the assisted decision making, we still have a way to go. And it's great to see so many of the older persons organisations being led, and so their agenda is set by older people themselves. We also have to see that at times people may not see what's happening to them.
Yeah.
And it's hard then to take what I call self-guarding. It's hard to take steps when, there's a bit of culture there maybe.
Yeah.
It was okay, but actually maybe it's not okay that somebody harms or acts coercively. And I think the opportunity of podcasts like this, start those conversations in our families and communities. And even the impact of ageism, that we joke or make fun of, or we dismiss older people's rights and their perspectives and their needs, that actually that can impact how we prevent and respond to elder abuse. And so we'll be very, very minded of that. That's another part of World Elder Abuse Awareness, is that we did a campaign a couple of years ago, Human Rights Don't Grow Old. There's been a huge emphasis, the rights that actually stay with you. Don't go away. Regardless of your health and social care setting, be it in the community, nursing home, those human rights remain.
Just one thing on that though, just when you say some elderly people mightn't realise, what do you mean by that?
So I'll give an example, going back into my own practice. They might have handed over money.
Right, okay.
And they might have allowed someone to let someone into their house. Handed over property or possessions. Let someone dominate their life in terms of where they can go, what family members they can visit. And they may see that behaviour as the norm or acceptable. So I think there's a bit of a conversation and a narrative in what we see as inappropriate or abusive interaction. People go to www.hse.ie/safeguarding. We will put up a link to any recordings or events that happen, even if people are going back looking at them after the event. It's really important to see recordings of those events. So not only is we organising that national webinar conference, but there's lots of activity that happened locally, organically, from communities and safeguarding teams. Teresa would have mentioned we have 9 social work-led teams right around the country. And it's really important that people understand you can get in touch with the HSE.
Yeah.
And that there's ways to report abuse. And if you are concerned, you can actually talk to a duty social worker about something you're really worried about and concerned about. Part of the World Elder Abuse Awareness Day is making people aware that our teams are there. They have a role and they will follow up any concerns or reports. People may go to a health and social care professional as well, public health nurse or their doctor, but they can come direct to us.
Okay.
And we welcome that.
We're talking a lot about recognising it, but if I suspect somebody of abuse, where to go? So it's the HSE.
HSE.ie/safeguarding. All the contact details are there. The phone numbers. We also have an online system for people who want to report it in through that route. People can phone out there in the community. We would ask that health professionals use the online route. But for members of the community, family members, there are phone numbers there to contact. As I said, the safeguarding teams also give advice, guidance and support. Sometimes people are just worried and they need someone to talk it through.
Yeah, actually, that's a very good point. So you might have a concern, but actually just talking it out, it may not come to anything, but it's just that peace of mind for somebody as well, maybe a sibling.
Well, as well as thinking about what might be an indicator of abuse and informing yourself that there is a social worker there in your local safeguarding team that you can talk it through. Whether it leads to a formal safeguarding screening or not, the important bit is that you have an opportunity to share the information that you're worried about.
Yeah.
And get advice and guidance. And it may lead to a formal screening. It may lead to a HSE getting involved. And we're very much led by the older person as well.
Yeah. And then if you need to involve anyone else, do the HSE take the lead on that? I'm just thinking of more serious things.
It depends on the kind of context, Eamon. We can get in low level, which we take seriously, right up to what we would call like institutional systematic abuse, where there might be a pattern within, say, a residential or a nursing service or a nursing home service, for example, where the pattern of abuse might suggest that the organisation or the institution needs to be looked at. In those kind of situations, we'd be working closely with the regulator, because the regulator has powers around compliance to national standards and compliance to regulations. And there are laws and regulations around what is expected. So yes, obviously we want to work with the service.
Of course.
So they would improve
and
address any deficits so that abuse can be addressed. But as I said, it can be an individual. One person could be experiencing something. Right up to a number of patients or service users could be experiencing something at an institutional level. And we get in all sorts of those reports from that one older person out there, right up to a report that we think people will contact us and say that they think that the way the organisation is dealing with the person is neglectful.
And when they contact, is it via email or phone number or?
As Tim was saying, there's 9 community safeguarding teams throughout the country. They compose mainly of social workers. There are some nurses in some of the teams, but it is a 9 to 5 service, Monday to Friday. So yes, on hse.ie/safeguarding, they'll get the telephone numbers of those 9 teams are on there. And as Tim was saying, they can pick up the phone and speak to a social worker on duty. But I suppose if it's out of hours then and somebody is concerned or very worried and they cannot wait until the following morning or they cannot wait until Monday morning, if they're very concerned, they can, of course, ring an Garda Síochána.
And our HSE Live colleagues.
Yeah.
We have a protocol with them. If someone does phone after hours and contacts HSE Live, they will give them information and direct them to the safeguarding teams. But as Teresa said, if someone thinks something is criminal, and somebody believes someone is in immediate risk of harm or abuse, do not hesitate. Both the community Gardaí right around the country, they are very aware of their responsibilities. And it's up for them to determine whether it's criminal or not. But if someone out there is feeling someone is at immediate and serious risk of harm, don't hesitate. The guards are actually very responsive.
Be taken seriously.
They will be taken seriously, yeah.
We talked about the different types of abuse, but are there signs that people should look out for? I know sometimes when you're close to somebody, I know with my own folks, they're very independent. And I call sometimes, as you say, elderly people, maybe some don't want to open up, but
there's obvious and there's not so obvious signs and indicators. So obviously for semi-physical abuse, if you spot injuries or bruising that you're worried about that you don't think could be explained or that you're quite concerned. So there's obvious signs of money missing. So there's what I call the obvious signs. There's then the more subtle signs, and Teresa can come in here and her knowledge and experience as a public health nurse, changes in people's behaviours. Become silent, they might become withdrawn, they might become anxious or depressed. No, that can happen. I mean, over the life course, people's psychological states can change. But if you worry that there's something causing that really concerns you, coming back to that Red Sea poll about recognizing it yourself, that something could be happening to an older person.
Yeah.
So there are those clear indicators. As I said, like something like financial abuse, you can see evidence that money was taken out of a bank account, that somebody didn't stole from someone's pension, or as I said, that stranger abuse and that scam. But we go into a lot in our work is those positions of trust. And, it might be more subtle. It might be a change in the person's presentation, withdrawn.
It depends on the various types of abuse. It'll manifest in different ways. But I suppose what's most important in particular for staff, for anybody that engages with older persons or anyone that's managing older person services, they need to, firstly, I suppose, complete the HSE land training. It's a 1-hour training piece. It needs to be done every 3 years at a minimum, because if people do not know the indicators of the various types of abuse, or they do not know the signs and symptoms, they may miss. And we know from past experience and serious case incidents that indicators have been missed or signs and symptoms of abuse have been missed. So it's vitally important that people have the training and have the knowledge and the skills to know what the indicators are of each type of abuse, whether it is physical abuse, sexual abuse, psychological abuse, or neglect.
And that's on HSE land?
HSE land.
Okay.
It's a 1-hour training that everybody that manages older person services needs to complete. And then there's also a 6.5-hour designated safeguarding officer training if one has more responsibility and services for safeguarding. And I suppose there's also, we have a reform programme on the way with the new Department of Health Policy and Safeguarding coming in. And there's also recommendations from the McElroy report being implemented.
There's a significant reform programme happening, Eamon, in the whole area of health and social care for adult safeguarding. And we will see future legislation which will strengthen the interventions when necessary. Again, I'd stress that we want to work with older people, empower them, that their voice is central, their will and preference is really at the centre, given that human rights perspective. And we talk a lot about safeguarding and making it personal, about the person. So we welcome that. We welcome the stronger human rights focus that's happened, but we need a legislative base to strengthen when we need intervention.
Yeah.
There aren't barriers there to it. But as Teresa has pointed out there, part of prevention is to inform yourself. And the way to inform yourself is that there's education through what was talked about HSE land, but also that it's a topic at staff meetings.
Right.
We're having this podcast today, that it's brought up in a proactive way and shift handover. Is there anything we need to talk about? Is there anything people are worried about? Through opportunities for continuous professional development at supervision, we have a toolkit for a manager's resources so that we look at every opportunity that we could see things that inform us. We have a self-audit tool for our residential and nursing services to help them identify maybe where there was gaps, maybe where there was areas that they need to improve on. Don't always wait for the regulator to come in and tell you that you need to do. People should be auditing their own practice. They should be self-auditing and looking for opportunities. So keep safeguarding at the centre. It's not just one day in June.
Yeah.
Important as one day in June is right throughout the year. And every morning when you come into work, be it HCA or a multitask attendant or a consultant or a cleaner, think how I can work better to put the human rights of the person at the centre, so I can think safeguarding. It doesn't mean you have to radically change, but it means that you have to have it there in your thinking and be aware of the possibility, but also what it can do to make improvements in terms of preventing it. And as I said, one of the things is keep it on your agenda, keep it on your team meetings, keep it in your supervision. Look at the resources that are out there. Talk to your colleagues and your managers why this is important. We've got some good resource material on our website. There's some excellent recordings. There's a recording on Open Your Eyes to Elder Abuse. And it's a really good practical recording of what you can do in your residential or nursing home. And there's also one in the community. Yeah. In a community context. It's well over 10 years old. While things have moved on, the message hasn't changed.
And that culture, I suppose, is so important that I think for healthcare professionals today who are so busy anyway, but even just being reminded that
we can minimise things. What we enable and tolerate, we endorse. So if we minimise something and we tolerate something, we're actually endorsing it.
Yeah.
And sometimes these conversations aren't easy, Eamon. They're not easy. Sometimes you have to be brave.
Yeah.
and to speak up. And we need to put the adequate blocks in place and the staffing in place that if someone does speak up and does speak out, that they're listened to. It's not an easy road. Having met with people who've been whistleblowers and others who've been brave enough to speak out, it is a difficult space to be in. To come and maybe go to a safeguarding team, to go to your senior manager, to make a protected disclosure to the regulator. It's not an easy thing to do, but it's a brave thing to do, and sometimes it's the right thing to do. And it's about doing the right thing sometimes if we see things aren't right. What we tolerate, I think, is what we promote. I think that's the saying. That's the culture. We should change that culture.
And Tim, I was just going to ask you about your experience working in this area. Are you long working in it?
So I've been working in both adult safeguarding and child safeguarding, I suppose, since the 1980s. And I started off as a social worker in 1991, doing community care assessments, going out assessing people for their home care, their care packages. So I've seen, and I've worked in a couple of different jurisdictions. I worked in England, Scotland, and a number of health regions here in Ireland. And some really good things have happened, Eamon. Some really positive. I think the Assisted Decision Making Act has been hugely important in advancing human rights. We've seen, thankfully, more investment. We've seen stronger education and training. The however is, we still have a long way to go in terms of having all of the support measures and the legislation and the investment we need.
And do you think the culture is changing?
Yes. The however is, sometimes it's still an awkward conversation. I recall when I started out in the 1980s in my education, that we were talking in the early 80s about the discovery of child sexual, but it's been there forever. Since the reports that were done in elder abuse going back to the 1980s and in the 1990s, we still are in a bit of a journey. I think it's got a greater profile. I think society is more aware. We've a long way to go though. And the figures that Teresa talked about, that we probably aren't fully recognising the extent of elder abuse. I'm a positive person by nature. I'm a glass half full. I think we've achieved a lot. The however is, we do need to continually keep this to the forefront of our discussions within health and social care. We need to keep it at front of government policy, and it's great that it's in the programme for government, that there'll be reform and legislation in this area. It's badly needed. What I say from our own colleagues in health and social care, that it should be continually on your team agenda and in your practice. So we still have a long way to go. It's never a destination. Our understanding today of coercive control, and when I started out as a social worker, has evolved and changed. We have a much better understanding of why that is an abusive relation, those abusive relations, and exploitation of positions of trust.
Yeah.
I look back at my own practice and I think, gosh, I might have missed things early on in my career.
And Teresa, would you have a similar view or?
Yes, I'm in the dedicated safeguarding role with the National Safeguarding Office over 2 years. I'm still pretty much a newbie in the dedicated role, but I'm a registered nurse, a midwife and public health nurse. I've always had a significant interest in safeguarding both children, safeguarding children or child protection, and also adult safeguarding. Working as a public health nurse with care groups right across the lifespan and from all socioeconomic groups and backgrounds, I have an unwavering commitment to safeguarding because it is a broad continuum of activity from prevention to post-abuse care. And I believe that we all deserve to live dignity and security, and we have a right to quality care. And as Tim was saying earlier, often it's not the legislation or the policy that will prevent or call out abuse, but it is brave people who will do the right thing and advocate for those, particularly those who may not be in a place to advocate for themselves.
Yeah. Do you think that, looking back on your career or where you're at now and the role you're in, do you think healthcare workers now are more likely to call out that abuse?
We're moving forward. We still have a long way to go. I think, as a society 40 years ago, we didn't believe that children were being abused.
Yeah.
So I think we are on a journey. We're moving forward, but we have to constantly remind people and reiterate the fact that quality care is vitally important. And advocate for, in particular, people that are more at risk, advocate for their needs.
I'd just like to add there, I suppose, Eamon, we've talked a lot today, and rightly so, about elder abuse and adult safeguarding and reform in that field. There's a wider piece though, and people will be aware of the Commission of Care for Older People and looking at how we age well. Teresa touched on things like housing, access to resources, access to healthcare.
Yeah.
And the type of choices for where we put investment in the types of, there's reform happening in the regulation of home care sector. It is much broader than safeguarding. I obviously, when I talk to organisations, I start off by saying to them, think about your HR policies and your finance policies, because they impact on the quality of care. Think about your nutrition in your residential centre. So I think there's a much broader programme of change and reform needed. I would argue that we need to look around how we position our resources, our societal priorities, and the type of care options we have, the continuum of care, the housing, the variety of housing supports that are out there. And actually, do people have choices?
Yeah.
To age well. So it's a wider question than safeguard.
Well, we're coming to the end of this episode, but I just have one final question for each of you. And Tim, I might start with you. And you mentioned the legislation, but are there any other new developments happening in this area that you feel will have a positive impact?
There's a lot happening in this space. It's a busy space. It can be very contested. It can be very contentious. I'm looking forward to the protection of liberty safeguards. And that's quite important. And it's another piece of the jigsaw, I think. And when people have restrictions in their lives, be it in designated residential or nursing care, we need to be very minded of they're only done necessary and proportionately. So the Department of Health, as well as advancing on adult safeguarding legislation, are looking at a way of structure, how those protection of liberty safeguards, because people do lose liberty when they leave their own home and when they're in care and they're in institutional care. But we need to make sure that any restrictions are only absolutely necessary. So I'm looking forward to that development.
Yeah, very good. And Teresa, if I was to ask you just for one or two final messages.
To reiterate back to that piece of research again for people, on World Elder Abuse Awareness Week or Day, 19,000 people over the age of 65 in one city had not had a conversation with a family member or a friend in over 1 month. I asked myself, could this be me? Could this be my future? Could this be the circumstances I'm in? Now, there may be a percentage of people that are okay with that solitude, but surely as a society we can do better than this. The message is please check in, stay connected. Connection is a safeguarding mechanism.
Yeah, okay. The one thing I'd take as well, and you both said it very eloquently, but if you do suspect somebody is abusing somebody, speak up and take action, because we know what happens when people don't.
Correct, Eamon. Yeah, it's important. Be brave, speak up.
Thank you for all that. A really important topic and some great information there. I'd like to thank Tim Hanley and Teresa Cronin for joining me today. To all our listeners, thank you for your continued support and please share this episode. If you'd like more information about HSE Health and Wellbeing, follow us on X, take a look at our HSE Health and Wellbeing YouTube channel, or register for Ezine by emailing healthandwellbeing.communications@hse.ie. This has been the HSE Talking Health and Wellbeing podcast. Thank you for listening.